Welcome to the Movement Upgraded podcast. I'm your host, Dr. Jen Hostler, licensed physical therapist and certified strength and mobility coach. Here you can expect to hear about all things movement. The Movement Upgraded podcast is a blend of the science of strength training, rehab, and mobility, mixed with the personal and professional experience to provide you with the steps you need to keep your body pain-free and moving well, so you can do what you love forever. Welcome back to the podcast, guys. This is Dr. Jen. I have Dr. Lauren Rivera here. I am so excited to have her on this podcast for two big reasons. Number one, we're going to talk about TMJ things, which I think are so cool. And she's specializing in TMJ and orofacial pain, headaches, all kinds of things. I'll let her give a little intro about that. But the other reason is because we actually worked together in my first year. She was already a year out, I believe, in the physical therapy world. So it was my first year in the real world after school. And so we worked together for a year. I feel like I wasn't myself that whole year and at all during the clinic, but yeah, we got to meet. And now, what is that, like 5 years later, here we are. She's starting her own practice, and I talked to her a little bit and saw all the content she's put out, and I just thought it would be so great to have her on the podcast. So Lauren, why don't you introduce yourself? Say hi.
Hello, everybody. Thank you so much for listening, and I'm really excited to be here. Jen, I'm so happy we have been able to reconnect, and I can't wait to talk about this topic. I feel like it's a very underserved and overlooked population of patients, and there's a lot of suffering around it. So I feel like there's a lot of things out there too that people just don't know and they need to know, and that can really help them. And so I'm just really glad that you are taking the time to let me be on here and talk about it.
Yeah, I think it's going to be really helpful. And that's really the point of the whole podcast and everything we do, right? So,
For sure.
yeah, and I love this topic. And I specifically have had TMJ issues, teeth grinding, like whatever. And I learned a lot of the stuff that you kind of like teach about through my own personal experience. And so,
Okay.
yeah, so obviously there's like a little like, oh, I'm interested to learn more from Lauren because I want to know if there's anything else that I'm missing, but also because I think some of the like, there's like some really big main behavior things that we can do to just kind of like adjust, like take care of those things. So we're going to talk about those today.
Yeah, it's very, a lot of people actually deal with it, but they don't address it. They don't talk about it.
Mm-hmm.
And the biggest population of people that deal with it are women between the ages of 20 to 40 years old. And I've even seen, I feel like that's expanding out into like the 50s and 60-year-olds. But it's just, it's overlooked because people go to the dentist and they maybe mention it because your mouth is like wide open, and that's the moment when they start to feel it, and the dentist is like, oh yeah, that's normal. A lot of people deal with that, and it's probably just because your mouth's open, or here's a night guard. But that none of that really addresses people's problems, and they think, oh well, I'm just going to live with it then.
Yeah, I feel like there's a lot of either band-aid solutions or there's like just kind of deal with it because it's so common. We've normalized it, but like how many things are common that we've normalized that we spend our entire careers trying to like help people realize like, hey, it's not normal to be in pain all the time. It's not normal to like throw out your back as you get older. It's not normal to pee yourself when you're jumping. Like none of those things are normal.
Exactly.
So, so tell me how you got like interested in this specific, what's the word I'm looking for? Like niche field.
Niche. Yeah, exactly. So there's kind of two parts to it. I actually have my own personal journey with it, kind of like you. I've dealt with TMJ problems and issues, and I'll tell you a quick little story about that. How it started. Nothing really stood out to me pain wise initially for a while, but I was in high school, and I was sitting down to eat lunch with my friends, and I had a sub sandwich for lunch, and I went to take a bite of this massive sandwich, and my mouth got stuck open and I could not close it. And imagine the panic that ensues if your mouth is stuck open or even
I'm
closed.
like panicked thinking about that.
So I like reacted and I slammed my jaw shut as like just every muscle in my face contracted to try and do so, thinking like, gosh, this is something is mechanically wrong with my face right now. I mean, imagine like a joint dislocation, it's terrifying. So, nothing came of it really except me just panicking. I thankfully didn't break a tooth slamming my mouth closed like that. But, and I think I remember being like a little uncomfortable, like in my jaw, but that was like my first experience with it. And it was a little scary. And after that, I was like, I don't ever want to eat a sandwich again. I'm going to cut this up into pieces.
I feel like that's like so common for like all injuries too, right? Like we get afraid of like the thing we get injured in, and then we're just like, I'm just going to avoid that. That makes the most sense.
Yeah. I will say that nowadays the American diet is so much bigger, like food is bigger, portions are bigger. So, sandwiches are getting bigger as they layer on, the Big Mac, and they add 75 patties to it. And it's like, our mouths aren't really built for food like that. So, we only open about 40 millimeters, and some of these burgers are like 70 to 80 millimeters. So you're really stressing the joint and the tissue there. And after that,
you're like
trauma.
You're like PRing the
right.
Like imagine trying to PR like a deadlift and like your back hurts, right? So like
right.
it's kind of the same concept for your TMJ.
Right. Or even think like from this perspective, how much tire pressure is in a tire? Like 30 to 32 psi. Biting a carrot is 30 psi. So it's like imagine the amount of pressure in your tire, and then like the amount of force that your jaw should be able to sustain. Anything harder than that, you maybe it can sustain a lot more than that, but you never really want to challenge that. But anyway, so after that, I had clicking and popping, and then I had this cool little like neat trick where I could like open my mouth really super wide and like dislocate or unhinge my jaw. It wasn't dislocating. I always said that though because I didn't know what I was talking about, but it was like, look at this cool trick. I can like make my jaw go out, and it can
like
open
kids
really
do
wide
that all the time. And so like I'm literally imagining it like, look at this.
They're like, let me stick my whole fist in my mouth, and I'm like, no, don't do that, please. So I dealt with this instability for a really long time. And I never really thought it was a problem because I didn't have pain. And then as I start getting older, I start experiencing pain. And I think a year or two later, the dentist told my mom like, oh, your daughter's grinding her teeth at night. Let me get her a night guard. So I was fitted for a night guard, it's good because it does protect your teeth. It's necessary for, I'm sure a lot of patients that maybe are listening that have had their TMD addressed in some capacity are fitted for a night guard, but knowing that that is not doing anything except protecting your teeth is a whole nother topic. So, and we'll get to that, but that's all that treatment that I got was like a night guard. And from that point on, I started to have like jaw tension and tightness and discomfort. I gradually developed digestive issues, sleeping issues, and it was just like so unusual and out of nowhere. But since that incident, there was like a lot of cascade of effects that happened down the road. And everyone attributed to stress because
I was going to say, did you like were you like aware of all these things as you were going through it, or you're just kind of like,
I just thought it was stress because I was going through a rigorous school programs, and especially in PT school,
that's not stressful. What are you talking about?
Yeah, I know. Just kidding. I had some really bad like gastro like related episodes where I like ended up in the hospital, and
that's pretty bad.
Yeah. So anyway, that kind of dissolved as I began to address my jaw issues. And the more I've learned, the better I've been able to manage it. And my journey is still not done. I still have things that I have to address in order to make it better. But I'm going off kind of long on this story, but anyway.
It's okay. It's important. I think it's important to hear people's stories because, and I've had people reach out to me on the podcast about it, and they're just like, it's really helpful to hear. Because one, I think it's like, I would prefer to work with a provider who's gone through what I have. I just think there's just insight and awareness and things that like, and
more
relatedness.
relatable.
Yeah. That like, you just won't get, and you can connect with people better. And I just also think that it's helpful to hear like things that work for you, because I talk a little bit about like research and evidence, and we talk a lot about that, but like we don't know a lot
Right.
about everything when it comes to pain and dysfunction. And so sometimes hearing like, oh, this is what I've done and this is what I've noticed, and like anecdotal evidence is still really helpful too. So I think people's stories are important. And it's like half the reason I
Yeah.
wanted to start the podcast, because I think I like hearing
Yeah.
about stories. So
Good. Okay.
that's cool.
So, but yeah, like I said, my journey is still going, and but I'm excited because of all the new information I'm learning, every week about how I can help people, and I'm already seeing people get better faster from some of this stuff, and it's possible to feel better. It's possible to not have jaw pain, and people think like, no, this will never change. So the
Especially if you've
other
dealt with it forever. Yeah.
exactly. So the other thing that got me more into it was we were getting patients at the clinic that I worked
Mm-hmm.
at with jaw pain, and no therapist like knew how to treat it. And you get what, 2 hours of a course in PT school about it? Like that's
Mm-hmm.
it. You don't really learn. You learn about the joint mechanics, and then you forget about it the next day, or except after your test, and you just
Yeah.
memorize it. And then like they don't even give you exercises on how to treat it. They don't
We
tell you
had like a
anything.
little bit more than that. We actually
Oh,
did
that's
like
good.
manual therapy with gloves and all that kind of stuff. So we actually,
Well, that's
I will
good.
give credit to my program, because I think I've said a lot about not loving my program, and I've said a lot of things. But I try to always say there's a couple things they did well. And we had like a pretty intensive pelvic floor course,
Oh, I did
which
too.
was taught by Sam, which was another
Oh, okay.
clinician that worked with us. But so we had that, and then we also had TMJ. Like we went and did more in the TMJ, and learned a little bit more about TMD. So I
That's
will give
good.
them props for that. But yeah, we don't really go into it enough, like at
Oh,
all. Like
yeah.
there's no like, and then if you don't go to a clinic where you really learn how to work with people, because that's where all the magic actually happens, then you're
Right.
really not learning how to deal
Yeah.
with it. So
Well, so anyway, none of the therapists in the clinic knew really how to treat it. So I took on like the challenge of trying to learn about it. And so I kind of became like the go-to between me and one other therapist who was semi-comfortable with it, and treated a bunch of cases and felt and got people better. And I was like, oh,
mm-hmm.
really shocked. Like this is super treatable, and it doesn't take that long to work on if people are like consistent and willing to work on it. So on top of that, I started doing research, and I found like a Facebook group with 75,000 people who are just every day saying like, I'm miserable, I'm depressed, I can't do anything in my life, I can't even take care of my kids. And I'm like, wow, this is a lot of
It's
people
pretty
that are
debilitating.
suffering. Yeah. And I'm just like, how do we get this out to the masses and like tell them like there's a way to feel better, and you really shouldn't be the first thing it shouldn't be a referral to like a surgeon for your jaw, or like
Yeah, there's no like good
Botox
in
injections.
betweens. Like,
No. And
yeah.
sadly, it's really like the dentists who see it first and hear it first,
Mm-hmm.
because that's where people are like, I can't really open my mouth too wide. And the hygienist is like, okay, well, just let me know when you need me to stop. And that's where it ends. So if we could educate also like the dental community, because they also get a very small amount of schooling in it. So we can't blame them.
Mm-hmm.
They don't
It's the
know
same thing
that
as physical
PT.
therapy. I actually have a dentist patient who actually likes TMJ, TMD stuff. And so we talk about
Yeah.
that a lot. And she's like, I'm actually kind of interested in learning more, because like I know how your bite, like she's like, your bite can really affect that, and like all kinds of things.
Yeah.
So, and I'm sure we'll talk about that, but it's really cool to hear there. I feel like the newer dentists that are coming out are kind of similar to like the newer PTs, where it's like
Yeah.
learning more information and kind of going off of that versus just like reproducing what the person before them taught them.
Right, right. And there's a lot of like dentists who are getting into like airway and breathing. And
Mm-hmm.
those dentists are also very like into and more aware of that. And they understand that this requires a team approach,
Yeah.
and it goes beyond just seeing a PT sometimes.
Mm-hmm.
Sometimes you need a sleep study and an ENT and other things like
Sometimes you
that.
need
But
braces because you need to fix your bite.
exactly,
Yep.
absolutely. Yeah.
So yeah, I think that it's really cool to hear like how your trajectory kind of, most of the clinicians that I'm really like that I know of that have specialized or are really good at what they do or really passionate, like it's all because we've had experiences and we didn't have anywhere to go. And so we basically become the clinicians that we like needed. And I think that's really cool. So thanks for sharing that. So let's talk about the TMJ and TMD, because we've been throwing these terms around and I know everybody that comes into the office or like that I talk to is like, yeah, like I've got TMJ. Like that's like the thing. And I'm like, I hope you do. Like, I hope you have a couple of TMJ like joints. So let's talk about what the difference is between TMJ and TMD.
Yes. Okay. Yeah. This is like one of the most common things about the topic is people just saying, I have TMJ. And I'm like, yes, you do. Good job. Yes. So TMJ stands for temporomandibular joint, which is just the anatomical structure. And we have two of them, one on each side of our face, kind of like right in front of our ear. And TMD is temporomandibular joint dysfunction. So it's either TMD or TMJD is the acronym for it. So when you have the problem, you say, I have TMD.
Yep.
The actual joint is just TMJ. Everyone has TMJ. So, but yeah, so the TMJ is a joint that has a disc in it. So the mandible is sort of the bottom part of your jaw that helps your mouth open and close. And that's kind of like a hinge sort of joint. And there's a condyle at the end of each side of that mandible. And that goes into basically it articulates with your temporal bone, which is like, think about your temples on the side of your head there. But right in front of your ear, your temporal bone kind of ends and articulates with the mandible. I won't get too anatomical with it, but
it's okay. A lot of the people who listen to this like the science. So like I had Ryan on here before and I was like, we're going to talk about this. And Ryan's like, I'm going to sleep through this. This is so boring. Not really.
I have heard some of those podcasts and I'm like, ooh, is this going to keep me awake while I'm driving? I'm just kidding.
But it's okay. But I know that like a lot of people who listen to this podcast really like the science.
They appreciate
don't even be afraid to get super sciencey here. We all
okay, good. And so there is a little disc on each side there, and that disc kind of guides the movement. So that disc is important for the movement to be smooth. And if the disc is dysfunctional and not working properly, you get that clicking and popping kind of noise. So that brings me into what TMD sort of is more specifically. The dysfunctions of that joint surround, it's kind of classified into 3 or 4 different topics. You've got like myofascial and soft tissue sort of dysfunctions, which every patient who has TMD has myofascial dysfunction. It doesn't matter if your disc does X, Y, and Z, like you also will be dealing with a myofascial dysfunction.
Is it the chicken or the egg? That's the question.
That is really it. That is the question.
Yeah. But they always coincide.
They do. Okay. They do. Not everyone that has myofascial pain, though, will have disc problems. Right. So that's one of the differentiators. So the second category is the disc dysfunction or the joint dysfunction itself. So you can have like that disc kind of coming out, which is what I've dealt with. Like when my mouth over opened, something pulled, something stretched, and now the disc is no longer stably staying on the condyle when I open and close. So those tissues do hold on. We have attachments, we have muscle attachments that even attach to the disc itself. So it's a very complex,
right?
Yes, it's a bifibrocartilaginous disc. Yes.
Would you say that, because this is kind of like how I've always thought about it, so you can always correct me, obviously, but the way I think about it is like when you've had like a kneecap dislocation, so like patella dislocation, like you're more likely to have them after, but like you still have attachments that we can like strengthen and kind of adjust. So yes, and a lot of it's kind of alignment issues and things like that on top of like making sure that things are balanced, I guess, for lack of better words, but that's how I think of the TMJ. So
yes, you don't always have to get your disc back into like perfect position, and sometimes it won't, just because of the trauma that might have occurred. So as long as you're strengthening and reinforcing like the other structures around it, you're going to put it in a more stable environment. And it's interesting too, because when the disc moves and if it doesn't really go right back to where it is, you can actually reform like let me put it this way. The disc does have some sensory, like nerve-like input, and it can be painful. should say innervated or vascularized is more of what I'm thinking. If it shifts and it becomes very painful, you do have the ability to create kind of a new normal spot for it. Like that vascular spot can kind of I don't know. I don't want to call it a callus, but imagine what a callus does.
Yeah.
It kind of protects that spot now. So, but that takes some time to form and it can be kind of painful. But if you have a trauma, sometimes you don't really have a lot of options there and you can heal it that way. But sorry, that is definitely getting off on a tangent.
That's okay.
About
I
the
think
disc.
that's really interesting. That's why I wanted to ask. So there's two main categories of
Well, there's a third.
three. Okay. So let's go back into
and
that.
there's even like a fourth that doesn't really get addressed as much either, but the joint disorders is a third one, and that's like osteoarthritis or even like rheumatoid or arthralgia, as those kind of some of those garbage bag terms for it. But that's the third category if you're dealing with it. And then there's a fourth that's kind of like not official category, but it's the psychosocial aspect, which is everyone.
I was gonna say that's probably all of them. It's probably like that and one of the other three.
Exactly.
Yeah.
But you can develop like TMD from a traumatic event that's more psychosocial in nature, as you can imagine. The autonomic system kicks in and we just, you overactivate things that just don't need to be activated.
Yeah, we hold tension somewhere usually, and that tension a lot of times goes to our jaw. I know that a lot of jaw stuff is correlated with pelvic floor dysfunction as well, probably for similar reasons, and also probably because your breathing changes when you're stressed, and that reinforces some of the neck and jaw issues that I'm sure you end up seeing. And then also that reinforces pelvic floor issues, because what keeps our pelvic floor healthy is breathing very low and slow and getting a full breath. And that's what helps relax our pelvic floor. And same thing with the opposite breathing pattern, which would be like up in your neck, which stresses you out.
Well, you have 3 diaphragms. You've got your pelvic floor, you've got your respiratory diaphragm, and you've got like your pharyngeal diaphragm. And those all, like if one of those diaphragms is affected and not functioning properly, the other, it's a pressure system that's regulated through them. And you have to have control and regulation through all of them in order to have that kind of harmony in your muscles.
Yep, that makes a lot of sense. So if you didn't know, there's connections there. So those are the 4 categories of, so those are the 4 categories that you work with typically. Is that what, like, those are not,
those are
TMD?
Those are the category, that's how to categorize. Like if you have problems that it's in one of those categories.
Gotcha.
Anybody that has TMD symptoms, you're going to be in one of those categories, or you might be in several categories. You won't only be in one, but that's kind of how to classify it.
Cool. Yeah. Well, I didn't know that. So thanks for sharing. I'm sure that's helpful for people to kind of understand. So there's going to be people who have already know that they have some of these issues, but we'll get to that kind of at the end. But the next thing I wanted to ask is, like, what are some indicators for people who may not know that they have TMJ issues or TMD? What are some like common things that people wouldn't recognize, or maybe they would, that are an indicator that you might have this going on?
Well, I'll list out like some of the typical symptoms that, I mean, some people have pain in their face and they don't even know what a TMJ is or TMD. So even though it seems like an obvious symptom, they might be like, oh, that's interesting. I have that. We all come to that realization at some point. So yeah, some of the typical symptoms would just be pain in the jaw and around the joint itself, which is kind of like directly in front of the ear. Pain inside the ear. People think they have an ear infection, which is kind of interesting. They're like, oh, do I have an ear infection? And they don't know that that's actually so close to the joint. So it could definitely be jaw related.
It's funny because Ryan just had some ear pain the other day and he was like dealing with some of that. And we realized it was very like, stress induced, but also he had worn a new pair of sunglasses and there's like the really superficial nerves that go right there. And so we realized that. And I was like, you've got a couple of nerve things that are sensitive lately. I guess we need to manage your stress better. He's gonna be pissed if he listens to this. And he's like, thanks for throwing me under the bus. But
like telling my stories.
I know, but thanks for being a good example, Ryan, because it does happen. And luckily, because I know some of that, I was like, this is probably like a nerve related, like muscle and nerve related like sensitivity. And And so like I did some work on it, and we found some spots
Kind
that
of
were really
alleviated
sensitive. It alleviated a little bit, but it was like super sensitive, which just reinforced that's what it was. I was like, you really just need good night of sleep and like some stress management. So
Yeah. Don't wear those again. At least not for a while.
he did wear them. Actually, he's been wearing them. It was just literally like he wasn't sleeping well and stressed. And so I was like, let it calm down and
the combination.
Yep. And I was just like, when you go back to wearing them, obviously don't wear them for like 2 hours again. So it's just re-exposure. Isn't that what we do? Like always.
Yeah. It makes me wonder too, how many like people have had ear pain and then like went and got antibiotics unnecessarily for it.
I bet so many, because a lot of people have pelvic floor issues and get like over medicated with antibiotics because they assume they're all UTIs, and they're usually not, but they don't know what else to do for it because we don't know much about pelvic floor. So,
well, that brings me, I'm going to talk about the antibiotics again and something that's unnecessary treatment in a minute with the atypical symptoms, but going off of like the main symptoms, other ones would be just like general facial pain. Maybe you have like orbital pain around your eye or around your mouth, going into your sinus area, even down the neck and temple area. So those are signs that you could have TMD. And then joint sounds. This one is interesting because in the PT world, we like to, this is important that people don't feel like joint clicking and popping is bad, because it happens and it's normal throughout the body. The only place that it's not considered normal is in the jaw. So I don't like to scare people. We try to do the opposite, right? Like we don't want people to feel terrified that like, oh no, their jaw is going to come out. But it is important to note that if you are dealing with a lot of like clicking and popping and stuff, that is not considered normal for the jaw.
Unlike it's like a sign that the joint just isn't functioning ideally or optimally. And so like, can you get away with it? And people could like deal with it and never have pain probably for their whole lives. Right. But like, if you're somebody who's like, I have pain, I have issues, or like, I have capacity to like deal with this now. Like, okay, so this is something that can be addressed and most likely should be addressed, then we should address it. I think that's like that perfect middle ground of not fear mongering, but also being like, I mean, this is not ideal. Just like sometimes when I talk to people about like hip pinching, like, can you push into it and stuff like that? Yeah, but like, it's still not ideal. It's still telling me there might be something else going on. So I usually tell people to kind of tackle it, address it. But
and I mean, I tell people like, just because it's clicking or popping doesn't mean your jaw is going to like pop out or dislocate. It just means that something there is not tracking nicely, and we need to create a more stable environment for it so that you can eat without these loud pops. I mean, I was talking to someone the other day and they said every time I eat around my friends, like they just judge me because they hear these really loud joint popping and loud cracking noises. And they're like, are you okay? Are you eating carrots only? But it's just like, it can be embarrassing for people. So, and that's not good. Something is structurally not occurring the way it's supposed to. And we don't want joint breakdown to be accelerated.
In general, right? I feel you. Okay, so that's another one.
Ringing in the ears, which is a lot of people have tinnitus, and that surprisingly is something that you can have with TMD, and it's because there are little muscle structures connected to our eardrum, and getting your jaw in a better position can kind of help with that, and tracking. Again, a lot of it's tracking and control. But let's see. Also, bruxing and clenching. That's like one of the most popular ones. If you're being told that you grind your teeth.
Yeah, that's what bruxing is, by the way. If you're listening to this, bruxing is teeth grinding. It's the fun medical language.
Yes. Thank you for clarifying that.
Yeah.
I dealt with this, and I even woke up like clenching my teeth every morning. I thought, geez, what did I dream about? Like, I'm just waking up with my teeth pressing so hard against each other, and I look like I was like straining off my pillow, and I'm just like, okay, just relax a minute. Like, what are you doing?
I hate that. I know exactly what that's like.
I mean, we drive and we, not really road rage, but like you just like stress on the road, like
life rage.
Yeah. So those are like some of the more common ones. Some that maybe aren't as typical would be like ear fullness, like feeling like you're underwater. That's another one. This is the one I was going to say earlier, tooth pain. I can't tell you how many people go and get a tooth pulled or go to the dentist and are like, oh, maybe it's an infection. Here's some antibiotics. And next thing you know, they've had like half their molars pulled out because they have pain there. And really they have TMD. And
How
it's
much
like not
excessive
good.
treatment happens so much when it's like, did we really need all of that imaging or all of these excessive things? Or could we just like understand how the body works a little bit and maybe,
Yeah. And then you set someone up for even worse issues when their teeth are missing and now they don't have proper occlusion in the back of their mouth. And that throws off everything. There's a lot of asymmetry there. So,
or the additional antibiotics, which are really not great for our
so
gut
bad.
flora,
Yeah,
like
for real.
not good
That's
there.
for sure. The other ones are more like secondary, but they can, if you're dealing with these other things, these are things that could be your problem as well. Chronic headaches, digestive issues, poor sleep quality, and just chronic fatigue. And a lot of those are related to the fact that TMD is very connected to our sleep. And if you're grinding at night, that's not just because you're stressed out. This is something like that people do not know. This is not talked about enough, but if you are grinding in your sleep, it's because you have a sleep disorder that you do not even know about. No one has told you about. And it's because your jaw is trying to move out of your airway. Your body has to go to a lighter level of sleep and it has to move so that you can breathe properly in your sleep. And if you're getting out of your sleep cycle, your sleep quality is poor.
That's interesting.
Yeah.
People, a lot of, I'm big on the Aura ring. I know. Do you have an Aura ring? Are you familiar with Aura?
No, I looked into it the other day because I know that you have it and I've seen some of your posts and I'm like, oh, I need to get something because
It's
my
super cool.
Apple Watch doesn't really give me as much information as I thought it would.
I also don't like watches. Like the ring is like very light. It
Yeah.
looks really like thick, but like
Yeah.
it doesn't feel like anything. I can't wear a watch on my wrist. Like I have
No.
sensory problems, but like I
No,
just
it's
can't
very
stand it.
cumbersome. Like
Yeah.
it feels clunky,
And I don't
when
like
I'm
lights
sleeping.
or want to see that either, which I'm sure you can turn that off. But like, I love the Aura ring. But the Aura ring does show like one, actually, the new Aura ring shows your oxygen levels,
Oh,
which
two
is
stats?
oxygen. Yeah, so that's
Oh,
really
okay.
cool because it can tell you if you might have a breathing issue because your oxygen changes your oxygen levels, and then it also shows if you like come out of your REM or deep sleep into light sleep. So it shows like wakefulness or whatever. And so a lot of people who have a lot of wake time, if this is you and you have an Aura ring, if you have a lot of wake time, you see your like O2 sats kind of dropping a little bit, that might be a sign that you are having a breathing problem or you might be grinding your teeth and you don't know, because that happens a lot too, right? Like a lot of people grind their teeth and they have no idea that they do it because
Right.
unless you sleep around somebody who can hear you, you probably wouldn't know. Also, sometimes they won't hear you either. Like you can still be
Well,
grinding.
the only other way you're gonna know is if you do it enough that the dentist can see
Can
the
see it.
wear. Yeah, and then they tell you, and then they don't do anything about it.
Or they give you a night guard, which is
The
like,
night
cool, I'm
guard.
protecting my teeth, but I'm still grinding, which is not ideal.
Yes.
You're still having the sleep, you're still waking up a lot, which interrupted sleep like that has its own repercussions. And I think some of those are probably some of what you dealt with and some of your issues down the road for you. Because it's
Absolutely.
the same.
Yeah.
So,
Yeah. And a lot of
yeah.
people are like, why do I have these issues? Like, why do I have TMD? And like, when you really like, there's so much conversation that has to happen before you even like assess anything. And they don't even think it's important. But I'm like, okay, tell me about childhood. Did you fall? Did you hurt yourself ever? Like, I've had people who have fallen because, like, on their chin and had stitches and they're like, oh yeah, why is that important? And I'm like, that set you up for a long-term future of TMD issues and sleep
A lot of these
disordered
things don't happen
breathing. And
overnight. That's kind of like what I think is like, it's just like a lot of steps that are like the perfect situation that just this led to this, that led to this. And then it
yeah,
compacts into something where it finally becomes an issue that you get addressed.
yeah. Oh yeah.
Usually.
I did want to mention some other things that TMD comes up from is like hypermobility issues, like maybe like you're diagnosed or maybe you're not, but like Ehlers-Danlos, it's really common. There's a lot of comorbidities that like people with fibromyalgia, that it's more common in some of these circumstances. Improper like swallowing and chewing, you don't think that you do that wrong, but there's actually a proper way to do those things. And when I assess people, I see those little nuances and how they like prepare food in their mouth and how they manage it. And if you have pain in your jaw, you're really not chewing your food up as much as you should be. And then that's where the digestive problems come from. You're asking your stomach to do extra work. So, and then the oral posture is another one, just mouth breathing. We do mouth breathe a lot because we're in a very industrial world where there's a lot of allergens and dust and stuff in the air, pollution, and our nose gets clogged really easily, and people are stuffy and they have allergies and they end up breathing through their mouth a lot, and that puts the jaw in a very poor position to function. It pulls it backward, and we really need our jaw to be set a little bit more forward to function optimally. And that over time, add 15 years of that behavior, plus the improper chewing and swallowing techniques, that just leads to a lot of chronic pain over many years. It's hard to untrain that. And
a lot of it's habits. I feel like a lot that you work with, because
Yeah.
it's the same thing with the people that I work with. It's always like habits, and it's not just one thing. So yeah, there's that whole, I'm like forgetting the TV show and I'm getting really mad at myself for it, but Stranger Things, where they like make fun of their friend or make fun of people and they're like mouth breather, like that. There's a reason that that's like an insult, right? Like
Right.
it's not a good way to breathe most of the time. And I know there's sometimes like, really, do I need to focus on my breath? But it's like, well, do we really need to like force ourselves to exercise? Because exercise is an invention we made up anyways. But the reason we have to do things and focus on these things is because we live in environments and in settings that like aren't conducive for functioning like a human has evolved to function. And so we have physiology that is very old, and we live in worlds that are very new and they don't match. And so a lot of the times we do have to work on silly things like, how am I chewing? How am I breathing? How am I swallowing?
We're not hunter gatherers here trying to make a living.
Yeah. And hunter gatherers, like they moved more anyways. And they also chewed food that was like better for their jaw.
They sprinted after their meals.
Yeah. So like, and they had way more downtime. They took lots of naps, and we don't do that. So like, yeah, there's a lot of things that are to be said about that. So yeah. So those are like the most things that people who experience any sort of TMD are going to be experiencing, or signs they might be experiencing TMD, as well as those things. So those things are all good to know. So we could go down a lot of different paths, but I really like to use the podcast as building awareness a little bit, because really, I think a lot of people just don't realize there's hope for them, and there's options, and there's things beyond like what they've been told, or the only option that they've ever seen or heard, or it's normalized when it shouldn't be. And so I like to use the podcast also as like, what are some really basic things that people can take from this and implement if they're like, okay, I hear you guys. I have this, maybe I don't have the funds or the time to like work with somebody individually right now, which is a lot of people, or I like to kind of try things out on my own. Like, what are some things that I can do? Like, what are maybe like the top 3, or like, what are your basic behaviors that you pretty much have every single person doing that you work with?
So first and foremost, I absolutely have every person do this, like no matter who you are. And even if you think you do it right, there's a good chance you're not. And that's having a correct oral posture. And I mean, I'm guilty of it too. I find my tongue is not where it's supposed to be. My mouth is open while I'm vacuuming or gardening or doing something. So trying to keep your lips closed at all times. Your teeth should not be touching. They should be slightly apart. There should be a little bit of freeway space, because anytime teeth are making contact, there's tension. Your masseter muscle, which is a muscle that's the chewing muscle, the most common and tightest muscle that people deal with this problem, that muscle becomes instantly activated. And you talked about cumulative loads, in another podcast, and like you have to think about how active your mouth is throughout the day. It does need rest. Okay. So you can talk and chew and eat, but those things need to those things still need to be managed to some extent. You have limits to your mouth as well. So,
What you mean to tell me that all of my talking is a cumulative load for my TMJ? I never thought of that.
no, well, that'll be my second, that'll be like more, I'll talk about that more in my second behavior that you can start working on. But no, talking is
shut up,
usually
Jen.
okay.
Just stop talking.
Talking is usually okay. It's good. But anyway, so tongue should be suctioned up to the roof of your mouth, the whole tongue, not just the tip of your tongue. Your lips should be closed and your teeth should be slightly apart. Practice that, like when you're working from home or at your desk working in the office. Practice doing that, breathing through your nose, and see how that feels for you. You might find that your jaw starts to relax a little bit more. So that's one easy thing that everyone can start doing. The second thing, which I almost got into in this first thing, the first thing was reducing and eliminating like poor habits. So nail biting, cheek biting, lip biting, chewing on a pen. Let's see, clenching and grinding when like you're during waking hours.
Awareness,
like
yeah.
I mentioned driving. A lot of us are like white knuckling the steering wheel with our teeth together. That's another time to practice that nasal breathing and lips together.
I have people practice like mindful breathing all the time because teeth, like in my opinion, like teeth and that like clenching is like stress induced like a lot. So like, and we're just always on the go. And a lot of people I work with are very like high achievers. So they're also tend to be a little more stressed. And so like that personality is probably coincides very much with TMD.
Oh, yeah.
So
Yeah.
because I work with a lot of people and I know that it does, they also have more pain and things like that, which is correlated. But like a lot of the time it's just like a couple, like 1 to 2 breaths is like what I work on with people. And so like a lot of the times people will be like, yeah, I hear you, but like whatever. And they'll like kind of brush it off and I'll bring it up and it'll take like several sessions. They'll be like, finally, I got serious, whatever. And then they'll be like, I feel so much better, blah, blah, blah. So like, if you're hearing Lauren say these things and she's just like, just work on your tongue posture. And you're like, yeah, okay, whatever. Like, what do I really need to do? It's like, no, those things add up. Like, it's really like, and it's a lot of work up front, but like, I think one of the things when I was younger in my own journey of pain was like not realizing how much it's like behaviors throughout the day. It's not like this list of exercises that you do a couple times a week and then you're on with your day and you live the rest of your life. It's really like, what are some little things that we can kind of weave in, because those are what add up. So I just have to interject and say that. Yeah.
They have to be part of your routine, like brushing your teeth. Like you want to brush your teeth to avoid cavities. Well, these are things you have to incorporate for a healthy joint in your face. Like your face has a joint that needs to be healthy too. So you want to avoid that cavity, that that progressive breakdown and arthritic, thing that can happen. So, but so that cumulative overload really applies more to this last one. Is just like any added thing you're doing with your mouth besides chewing, swallowing, speaking is considered like a parafunctional activity, and that's something that's unnecessary load on your jaw. So we all do it. I bite my lip for no reason. I find something, I'm like, oh, I just need to get it, and I just do that for like 10 minutes and I'm like, something feels weird now. or I lean on my face, lean on my face. My hand leans on my face like that, and I kind of push into my jaw on one side, and that kind of asymmetrical force like builds over time. And these are little postural things that you just like don't really think about, but if you're a little bit more aware of that stuff, it will improve. The other one, which I kind of like talked about a little bit, is the nasal and diaphragmatic breathing. It has to happen. It's going to help keep your mouth closed, keep the jaw in a better position. Your mouth is for emergency breathing. Your nose is for just regular passive and active breathing. Your mouth is for eating. It's not, that's it. That's all it should be.
Maybe some other things, but like,
well, eating and speaking, I mean, like, it's not for breathing purposes. That's for an emergency if you needed to. So that's going to help. And if you can't breathe through your nose, there's a problem, and I posted something about that. If you can't sit there and breathe through your nose for 2 minutes straight without a struggle, there's something wrong there. You need to follow up with like an ENT, because that's important.
Sometimes it's just like getting used to it. Like a lot of people, because they're so not used to it, like your nose has like a filtration system. It humidifies the air. And so like sometimes it's like almost like painful until we get adjusted to it, just like starting a new exercise and you have DOMs, like it just takes periods. But like some of my people that I've worked with, I've had them like pull open their nose and like stretch their nostrils and just like, you know, these things so that you can breathe. But like you said, you have to do it. And I think one of the things that I wanted to add on to what you said about how the breathing is so important, because it takes like, it puts your mouth in a better position when you're not using it to breathe. Also, breath work, we've talked about this a lot, but it decreases like stress. When we're stressed, we change the breathing pattern that we have. So when you're stressed, you go into emergency breathing. That's like our fight or flight or freeze sympathetic mode. When we're not stressed, we go into parasympathetic, rest and digest, recover and repair. I like the 2 R's that I've added on to it, but I like that concept. But like, that's the type of breathing that's in through your nose. It's calm. It's a very low breath and it's not quick, shallow breaths, which are our emergency breathing. And so we've talked about this in other podcasts, but you can actually pull yourself into one or the other parasympathetic or sympathetic system just from hacking your breathing. And hacking just meaning just breathe through your nose, breathe very slowly. And that can trigger you to get out of that anxious state. So if you're somebody who has like a lot of anxiety and that correlates with a lot of your attention and your teeth, like I wouldn't say clenching, maybe clenching, but like if you're somebody who holds that posture a lot, or you tend to do that, probably breathing is also going to help you feel a little less stressed. So it's going to reinforce that behavior. And all these things are kind of like a cycle, and you have to like find a point where you break the cycle.
Yeah. And I'm glad you brought up like the fight or flight phase, because the tongue being to the roof of the mouth actually stimulates the parasympathetic system. And I want you, this is a good example. Think of a child that sucks their thumb. Their thumb is up to the roof of their mouth, and it's a form of like stimulation to calm their system down. You know, think of a pacifier, like they're crying, they're anxious.
I never realized that it was probably like something on the roof of their mouth. That's probably like very grounding. That's pretty cool.
It's connected to the vagus nerve, and it stimulates and calms that, and it activates your parasympathetic nervous system. So having your tongue up to the roof of the mouth is actually really important, because it facilitates that more. And with mouth open, tongue down, you're likely more in that autonomic state. So just wanted to add that.
Yeah, that's I didn't know that, but I think it's really helpful to kind of like hear these little things, because the little things are the big things. And we talk about that a lot on the podcast. And sometimes it's really daunting to think about like 100 different exercises, like, oh, what do I need to do to fix things? And it's like, maybe you don't need to fix a lot of things. Maybe we just need to adjust your behaviors. And like, maybe you still do need like some exercises to adjust things, but like most often they need to be more consistent with behaviors first, because that's what helps them feel better. And you can do these exercises, but again, if you're not undoing them, because you don't like that concept or that phrasing, but like you're fighting against yourself if you're not adjusting your behaviors throughout the day too. It's like you're having to work 10 times as hard.
Well, and behaviors, like that just brings up something else in my head. So like think about orthodontics too. If your tongue is not behaving correctly and it's thrusting when you swallow, and that can cause TMD issues. But anyway, if you don't control how the tongue behaves, and that causes orthodontic issues. And if I had like a picture to pop up and show you, I would show you, but you can see some of these malocclusions on people's teeth, the way they're formed, and their teeth kind of sticking more forward, or there's like an opening in their teeth when they smile between the top and the bottom. Their tongue is trying to shove forward every time they swallow. So if you send that person to an orthodontic and they get braces, but you don't fix the tongue, and then the braces come off, you are in that bad habit, and it's going to bring you right back to square one again. So it is about fixing the habits first before you really try to implement like a good treatment plan. I definitely agree with that.
Yeah, I feel like that is, it's hard to accept, but I'm thinking back to like my own experience with it, because I knew I was grinding my teeth from a very young age. I had like a lot of anxiety and stress, which was anxiety, just like not diagnosed as a child.
Right.
And I had braces, and like they did like the expander and like widen my mouth, did all these things. Right. And I feel like I was still grinding my teeth after those. And then my retainer eventually like stopped fitting because my teeth were still moving. And I got diagnosed with like exercise induced asthma when I was also around that time. And so looking back, I know that like my breathing was a problem because my asthma, like I still have it a little bit if I like really push, but I haven't had an asthma attack in over 10 years because I know how to like
Breathe
adjust it. And I don't have an
properly.
inhaler. Like I haven't gotten it filled because I just don't like, yeah, I breathe properly and I like stop and like work on my exhales. And like, I've learned a lot of the breathing stuff that I teach my clients that have really helped me with that stuff. But I'm just looking back at it like, oh, I wonder what would have happened if somebody, instead of like going down this, I went down this whole path of allergies and allergy shots and all of these things. I wonder, and I had my tonsils and adenoids out. Like I
Oh
had
my goodness.
3 ear surgeries with tubes in my ears. Like,
You are like the low key client that has like the maybe TMD with sleep disordered breathing.
uh-huh.
You probably breathed with your mouth open when you were at least sleeping.
Oh yeah, when I was little. So like I've experimented with taping my mouth shut, which I
Okay.
would not recommend. Like I'm not recommending that on this podcast, but like experimentations, what I would like to share. But like just with rock tape, I actually have a bunch of old rock tape that I don't really use in my office, and I'm like, it's
Yeah.
perfect because it's like not claustrophobic. But I have done that and like worked on a lot of my like postural habits, but I'm hearing you talk about some things. I'm like, I have some more things. Like I've learned some things from you. I'm like, I
Yeah.
have some things that I could improve on too still. But like that's like why I like sharing about that on the podcast, because I'm not a provider who's sitting here and being like, yeah, I know everything and I'm perfect
Right.
and whatever. I'm just like, I'm on this journey too. And I might know a little bit more than you and I can help guide you. And that's like what I do. And so it's really cool to be able to hear some of that. But yeah, I am literally like the TMJ
Yeah. You,
problematic like patient because of the, I think if you're listening to this podcast, you're like, wow, Jen, is there anything you haven't had? Probably not, because I've dealt with so many body issues. This is like why I'm on this. And I think a lot of them all stem from like the biopsychosocial like stuff for me, which is probably why I also tie into it. But yeah, anyways, I think it's really cool to hear about all of those things and kind of look back and be like, oh, so these kind of tie in.
yeah.
Like everything's kind of related. And I'm sure you work with people who it's like way more simple, but
It definitely fluctuates for
yeah.
sure. Yes.
Yeah. So the other thing that I wanted to ask you about is what like are some of the like biggest like main exercises, like what can you do for like a jaw that you that like we talked about how we have a lot of the popping and clicking and it's not sliding and it's gliding or sliding properly, so
Right.
like what are some things that you kind of do and work on with patients when that happens?
So I do go through more of like a jaw stabilization type of, I wouldn't say program, but that's kind of like the first week or two of really trying to address that issue. And we do work on some isometrics, making sure outside of course, going over all of those good oral habits of like
Yep.
where the tongue should be and that we should be nasal breathing. We work on some isometric exercises for the jaw. And then I have people really, they love the mirror, but the mirror is so important. Got to look at the mirror.
I know people I work
So,
with, they're like, I'm like, video yourself doing the exercises. And they're like, yeah, okay. And then it's like 6 months later and they're like, no. I'm like, we've got to get over it. Like, just get used to
yeah.
your face. Like, I hate my own voice. And like, I still have a podcast and like, sometimes Ryan's punishment is playing this really loud for me to hear. It's really rude.
Oh gosh, I can only imagine. I'm not looking forward to re-listening to this for my voice purposes.
You get used to it kind of, but if it's like out of nowhere and you're not expecting like a very loud amount of your
Yeah.
own voice, you're like, oh my gosh, my ears are bleeding.
Oh, who is that?
Yeah, it's really fun. So
I
just
totally understand.
yeah. Anyways, so side
But
note, but back to the exercises. So
yeah,
in addition to doing the things we talked about, behaviors
yeah,
and habits,
yeah.
from there you have a jaw stabilization like
Kind
program
of
that you start
routine.
people with. Yeah.
Yeah. So but yeah, so first I'm also looking for asymmetries, like if it's clicking and popping more on one side, like we kind of look at that, and also address like also sleeping habits, like are we laying too much on one side, stuff like that. But jaw stabilization as in like isometric activities, getting, kind of putting pressure on each angle of the jaw, light pressure, just to get muscles to start activating and contracting. I really like motor control type movements for it, because you got people who open their mouth and their jaw kind of deflects to one side, and
That happens a
that,
lot.
yeah. And so like you imagine anytime your mouth is opening, you're like reinforcing that movement and that behavior. You that's an indicator that the side it's deflecting to is probably a more restricted side, or that side is not gliding or translating properly. So we're thinking about stretching to the opposite direction because maybe it's a muscular issue and pulling. And so we might do some lateral stretching and kind of loosen that up to help improve the more midline opening. And then on top of that, I have them just look in the mirror and open their mouth and close it and just have them make little corrections. You have to do that slow, partial, just little opening, because sometimes if you just keep opening all the way, it just keeps going, no matter how slow you go. You kind of have to do it little by little. And I have people sit there and kind of train their muscles to activate symmetrically with partial opening and then with full opening. And we use the tongue for certain movements like that because we do need to be able to move our tongue separate from our jaw. They really shouldn't, they do move together for activities, but if you don't, you had an example of this in one of your podcasts too. You have to really
say like independence before interdependence. We have to isolate before we can get things to work nicely together.
Yes.
Yeah.
There you go. That's what I wanted to say. So yeah, I try to do that, get the tongue moving separate from the jaw and the jaw moving a little separate from the tongue. And then we try to coordinate the two together. So those are a few of the things that I kind of start with when it comes to improving that tracking and minimizing the clicking and popping. A lot of it also is, I'm going to go back to behavior again, like what's their posture like? Are they leaning forward? I had this problem where I like would lean forward to take a bite of food and open my mouth and I'm getting like pop, 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 and then close and chewing and popping. And so I found that if I bring the food up to me with my chin slightly tucked, I got zero popping and it was so much more comfortable. So there's little things like that you just have to look at and address. So
yeah, and I think we just recorded an episode about posture, and posture is one of those things in the episode that I talked about that it's like when we're talking about posture and like how you statically are like in a position, we don't necessarily need to fix the curvature of your neck or whatever. Like when we talk about posture and what Lauren's saying right now is sometimes when you are doing a movement, your position matters. And especially, and this is a future podcast I'm going to bring on, which is going to be talking about like form and posture in movement, but like it changes the mechanics of things sometimes. And so when you're going through a rehab or you have a dysfunction or something going on, it becomes a little bit more important and temporarily, and sometimes maybe for a while, but like, yeah, I just wanted to highlight that because I don't want it to sound like contradicting that, like in one podcast, I'm like, your posture doesn't matter. And then another Lauren's like, yeah, but by the way, like, this is what we do, because it does matter in some things. It's just something we shouldn't necessarily be afraid of and be like, oh my gosh, like I went down a whole path, and I talked about that in the podcast of like trying to fix my scoliosis, which is like stupid. I mean, it's not stupid, sorry. But like, it was like, it caused more problems for me than anything. Right. It just really fed into body image issues, which is like, I'm not trying to fix myself. You're just trying to find a position where maybe you don't have those issues. And like, if you are decreasing how much stress and strain is going through the joint, you're probably going to have less issues with that joint, which is not the same for most of our other joints, by the way. You still need like load and stress, but it needs to be in a controlled manner in a way that like where the joint's functioning like it should. It's like we always talk about. So I just
there are optimal positions, you know, versus less optimal positions.
Yeah. And it's always specific to certain things, but especially in the jaw, it's like very, the jaw's very unique.
There's really not like a lot of variability on like where the jaw can go. It's kind of where it is. Doesn't have the motion of like a shoulder or a hip. It's kind of
like your kneecap. Like it's got like a bit of motion in all directions, but like there is a very discrete position that it's not supposed to be in, which is like completely lateral and outside of your knee. And like, that's not where it needs to go. So, and it will become painful if it's out there, right. Not to mention you'll like panic because you're like, this looks terrible. It's like traumatic. So yeah, I just wanted to highlight that, but I don't even know what we were talking about at that point. But we were just talking about your exercise and the exercises and the posture, what you do. So, but yeah, there's a lot of things that there's a lot of things that can be done about any sort of TMJ issues. And so that's a big reason I wanted to bring Dr. Lauren on here to talk about. And also, I think that even if you're like, I don't really have any issues, like some of these things might be good things to practice anyways, because I don't love the word prevent, but we like to take care of things before they become a really big full blown issue. And it's way easier if you're already working on some of these habits. Than if you were to not, because how much easier would our lives be if somebody came in and was like, here's all the things I'm already doing. I have this little issue, and you're like, cool, all I have to do is really look at your movement, like, and then talk about a couple things and make sure we check them off the boxes. Like that would be so much easier, which it just isn't like that, which is totally fine. It's part of the job. But like, if you can do a little bit here and there, it's always helpful. So I'm sure we could probably talk for like hours about all of this stuff.
Absolutely.
But
so many topics like going through my head that I'm like, oh, we can talk about this. But yes, that could be saved for a part 2 one day, maybe.
Yeah. So and you guys, if you are listening to this and you're like, this was so great, which I know you're going to, because it was a lot of really good information, just let me know and we can bring Dr. Lauren back. Like, if she'll want to come back, but she already said part 2. So that is making me assume that she'll come back. So, but yeah, if you guys really like the podcast, let us know. Because I can always bring her back. If you have more questions, let me know. But we're going to wrap this up because it was so good. So thank you so much for coming on to the podcast. Is there anything else that you want to leave people with about TMJ or TMD? Or anything related?
Sure. Like just kind of a little take home message.
Yeah.
A little bit about what Jen said. If it's something that's like not a big problem, but maybe something's brewing, it's not a bad idea to just get an assessment and just find out if there's something that you're doing that might be aggravating or creating an issue. Get it addressed ahead of time, because it can be a difficult thing to deal with when it becomes full blown. Also, if you're out there and you have TMD and you're one of those people that just has a night guard or mouth guard because you've been told that you grind your teeth and that's the extent of your treatment, get an assessment by a PT who knows about TMD and or a myofunctional therapist. I do both of those things in combined, but that's just something you're being overlooked. There's more help for you. You don't have to keep suffering with just a mouth guard.
And the person that maybe gave you the treatment may not there's more. So they may have helped you to the max of their ability. And clinicians and healthcare providers, I've said this a lot, but like we do the best we can and we don't know everything. And so sometimes like we'll be like, this is unfortunately what I wish more clinicians would do is say, this is the limit of my tools. Like I don't have any other tools, or I would help you find somebody, but like, I recommend keep searching. But what they do instead is tell you this is the answer, or this is the only way. Yeah. And so if you're not reaching your goals, or like Dr. Lauren just said, like you still have something going on, or you have like, you still have the only the night guard or something like that, just seek out somebody. And like, also like try not to be too mad at your provider for like not treating you properly. I kind of always like to say that because we hold a lot of resentment towards them. Yeah. And Lauren, I know you're not, but I like to tell people that, like, cause sometimes people will come into my office and we spend like a good 20 minutes. They just want to like they're really mad at their providers, and like, I'll validate it because really most of the time it's just because nobody's listened to them and they've been through a lot and it's really hard. But like, we also have to remember they're humans too. And that's just my little soapbox. That every time I say something like that, I always like to do that as well. And just remember, like they don't have the ability to, and we've talked about why and insurance and all of that. So side note, anyways, little wrap up on that. But you were talking about finding somebody who knows about TMD and maybe a myofunctional therapist. So do you have any way that people can find that? Or you just recommend usually people look at the clinics around them, see if they have like credentials?
Yeah, call around, because myofunctional therapy and PT are very uncommon to find together. You're more likely to find a speech language pathologist who does myofunctional therapy, but you likely need both in some capacity, not speech, but PT work and myofunctional therapy, which we didn't really talk about in the podcast, but that's still something very important. It has to do with the normalizing the function of your facial and jaw muscles, and you can get that in PT, but again, you have to seek out a provider that knows what they're doing. Not a lot of PTs have that knowledge. So you'll have to kind of you have to search around.
Unfortunately, you might have to vet out and try some too. It's like I've said about what if you're somebody who's active and you're going to a physical therapist, not all of them have strength and conditioning knowledge. And some of them think they do. And sometimes that like they'll only help you to their ability. So it's just sometimes you unfortunately just have to like call and ask and do your research and things like that. So I just wanted to know if you had any like tips on finding people. So
yeah, that is a challenge. I'm trying to build a more interconnected like system, a networking, so that I do have places to refer people to in-person care, wherever they may live in the, the States or abroad. The other thing I would say is also, if your provider, again, it goes back to them maybe just not knowing, and I'm on the journey to go and educate all the providers in my area soon. A lot of them don't know that PT is a thing that you can get for your jaw pain. So it's not their fault. They just may not know. So don't jump into injections and surgery right away, though. This is me telling you and educating you that those should be a last resort.
Just like everything else, we talk about that all the time. There are repercussions and higher risks doing that type of thing. Like injections seem like they're easy, whatever. Like I'll just get some injections, but like there's higher risk for that. And it's still not addressing the actual like root causes of the problem. So
Botox injections are very common in the patients I see, and they've had that first before even coming in. And all that's doing is making your muscles weaker, because it's kind of shutting them off for a while and it's paralyzing them so that they can't work. And that can actually make your problem worse.
Yeah, you need to teach them how to work, not just like, it's like when we immobilize a joint where I'm like, temporarily you might need to not move it because it hurts, but like joints stay healthy from movement. So like if we just immobilize it forever, we're actually creating more problems down the road, which is not good. So same thing.
So those are my take home messages.
Yeah, I think that's great. I think you might not have somebody in your area that you can find, because that's happened before. And if you've worked on all these things and you just want to learn more, I highly recommend following Dr. Lauren on Instagram. I believe your Instagram handle is Revive Your Life. Is that PT?
PT.
Yeah. Revive Your Life PT. And so you can find her. She's got a lot of really good education. She's more consistent than me with content on Instagram right now, which is good because I'm not. The podcast is where I'm most consistent, but she's got a lot of good content out. And I believe you have some maybe future things in the works where you can learn more. So I would recommend giving her a follow and kind of seeing what she's up to and supporting what she's doing, because I know in the beginning stages of working on all of that stuff, and it's really fun and it's a lot of work. And if you guys can go support her, then that's always helpful because it's more reinforcement. And if you have questions, like I'm sure she's open to answering them. So like go check out her page. And I think that was it. Anything else you want to say where you are?
Well, just, possibly soon virtual consults will be a thing. That's still a work in progress, but definitely coming in the future. Thank you so much, Jen, for allowing me to be on here and kind of spread the word out to the masses, and for using your platform for just like so many good things. And it's so selfless, and I love it. It's just so many truth bombs and like real talk, and the world needs it. So we can't be sugarcoating things, and we're helping people. So I love it.
Sugarcoating is not my strength.
No, it's not.
Well, actually, I know. I'm like, how do I say things? I'm like, I'm just going to say it. So whatever, which is good. So it really, I think, weeds out people who end up hanging out with me and like consuming my content, which is good.
We don't have time for that.
I know, I'm very much like
we need to be straightforward.
Which is probably why people have told me I'm intimidating in the past, but I'm just like, that's okay. You can be intimidated by me.
I will say, I saw your RBF when I first met you, and I was like, who is this?
Look, here's the thing. When you first met me, I was at a place that I didn't really want to be. And
you
so
looked miserable.
I was. It was not a good time. I didn't want to be there. And I looking back at it, like, cause it was my first year out of PT school when I met Lauren and we worked together. And I was like it was very, very hard for me. I didn't have very good coping skills, and we've done a lot of growth since then. But I was like very overwhelmed and I didn't really like the setting and the way that I was thrown into things, which now as I'm older, I really should have advocated for myself and like kind of set some boundaries. But unfortunately, I just didn't have the skills to do that. And I think that's really common. So if you're like a student listening to this, like I really highly recommend speaking up for yourself and learning how to cultivate those skills because they're really, really important. And then you have nobody to blame but yourself as long as you can do that. So that was part of it. But yeah, I was just not really, I was pretty miserable in that office. I was like crying most days on my way to or from the clinic. And so, yeah, it's really fun, but I don't like looking back at that year. I like, yeah, it was hard, but
Well,
regardless, and RBF is like part of me no matter what.
Well, I know your personality now, so it's not, it's not offensive.
That's good.
I appreciate the no BS, like for sure.
Yeah. I feel like you're kind of that way too. So it's like, it works out.
For sure.
So it's cool. Yeah. So, anyways, I am super thankful for you coming on the podcast. Thanks for taking the time and educating. I know this information is going to be really helpful. So I know that people are going to listen to this and be like, this is so cool. I want to learn more, which is always my favorite. That's why I love doing this podcast because it's a bunch of nerdy people like us who are like, I want to learn more and fix things. And so it's really cool. So if you guys have questions, I would highly recommend reaching out to her. Probably via Instagram is the best way to get a hold of you. Yeah. And she's got all of her stuff on Instagram. So she's got potential of things coming online. And if you're in the Tampa Bay area, that is where she's working. So you can work with her in person that way. So she is in the same area as me. And if you're not, but you want to work with her, just stay tuned because I think she has some things in the works. Yes. So cool.
Yes.
All right. Well, we will end on that. Thank you so much for coming. And thank you guys for listening to this episode. Don't forget that if you have not given us a 5-star rating, please go do that. It's how people can find us and know what we're about. And it's the best way to support all of this free content. And like always, you can reach out to me with any questions or comments. And if you know somebody suffering from any of these things we talked about, I highly recommend sharing this podcast episode with them so that they can get some of this information too, because that is the reason that this exists. So we will chat on the next episode.